Hi everyone, I'm Ian Harvey, massage therapist. Today we're going to be talking about side lying massage. So we're going to be coming at massage from this new angle, and I've got some tips and strategies for you that may be helpful, especially if this is something that you haven't really worked with since massage school. You might have forgotten some of the basics. Even if this is something that you work with regularly, maybe you do regular prenatal massage, I still think that I might have some advice that will make this more comfortable for your clients and make you more effective as you deliver your own body weight, make you more comfortable. We'll talk about how to set up the table, how to communicate with clients about side lying massage, and then we'll get a client on the table and I'll show you some specifics for each different part of the body. If you'd like to skip ahead, please click on the time codes down in the description. So the basic setup looks like this. I have a thick pillow for the head. I like a nice thick pillow, one, because it's just nicer when you're laying on your side, but two, it gives you a little bit better access to the neck. And I like a nice thick body pillow. I got this one from Walmart. It's nothing fancy, it cost me $8. You can also use two separate pillows here, one for hugging and one for under the knee. So the final piece to dressing the table, with the top sheet, I like to fold it away from the body pillow so that the client has an idea, they have a visual indicator of how they're supposed to climb into this table. If not, they could end up in all sorts of interesting configurations, and that's not what I want for them. The first time that you have a client try side lying massage, I want you to over-explain how you want them to lay, just so that they don't come into this and have a mini panic attack the moment you leave the room. So this is how I'll explain it. I'm going to have you lay on your left side. Your arm's going to go over this pillow here. Your knee is going to go over this part of the pillow, and your head will be up here on this pillow. And you'll be under this sheet. It should feel comfortable. It should feel about how you feel when you're laying on your side in your bed. And then I'll go on to talk about pressure level and undressing and all that other first time stuff that I usually talk about. And as I leave the room one last time, I'll say, once again, on your left side, under the sheet, so that there's no mistakes. I know that seems a little bit like over-explaining, but this way you don't end up with a client like under the table. All right, I've got Sam here with me today.
Hi.
Hi. And when you come into the room, you may need to reposition your client just a little bit. So Sam, go ahead and scoot your shoulders back about an inch or two. And as you have them move, if you need them to scoot back, but it seems like their hips are already too far back, specify their shoulders, and you can place a hand in the small of their low back as they scoot so that they don't bring their hips even further back and then fall disastrously off the table. Hasn't happened to me yet, but I want to prevent that. And next you can change their angle on the table. So Sam, go ahead and bring your bottom leg out behind the pillow. Good, good, good. And if that ever gets uncomfortable for you, you can bring your leg back where it was. And so grab onto this pillow like you're hugging it and roll toward it. So roll away from me. Good. Okay, so now I have them pretty close to me and angled away, so rolled away. So now I've got a nice 45-degree angle. And you'll notice that I have kept my traditionally low table. This is nice because I can step back and apply pressure to their body at a good angle, and I can still get over their body and apply pressure downward using my body weight. If this table were 5 or 10 inches higher, that would be much more difficult. I am going to be touching on draping some during this video, but if you'd like a more extensive explanation of side lying draping, that might be more the topic for a longer course. To start, Sam, go ahead and bring this arm up and over the drape so that you're kind of pinning it down to the pillow. And this arm can go wherever it's comfortable. And after that, I will anchor the drape to her low back and then fold away. And that gets me kind of a nice triangular section of the body to work with, but that's not enough. I want to be able to get down to this QL region. Get yourself some extra slack in the drape by pulling up from the foot of the table up toward the head of the table. And then anchoring once again at the low back, we're going to roll this away and form an L shape. So it's not very pretty, it's not very crisp, but this rolled up, bunched up drape does create a nice thermal barrier. And end by tucking under the hip just a bit. So now instead of just having kind of a slice of their back to work with, we have their entire low back up. So when you're doing a side lying massage, just realize that you can apply plenty of pressure, but that it can feel safest to apply that pressure at 45-degree angles to the spine. So apply pressure up toward the head and down toward the sacrum, instead of applying 90-degree pressure toward the back, which can roll them away from you and feel a little bit unsafe. Now, that's not to say that you can't apply plenty of pressure. It's especially easy when you're doing this bilateral work. I've got my elbow anchored into my hip right here, and that's letting this pressure come from my stance. And I can just generally lean into this. This is a great way of broadening up the rib cage and ending by incorporating the upper trapezius. And the same goes for coming from superior to inferior, applying this nice bilateral pressure at kind of a 45-degree angle downward. I've got my elbow tucked into my hips, and my body weight is driving this pressure. This is great for decompressing the low back and for starting to mobilize this pelvis. You may have noticed I did work a little ways under the drape just now, and whether you are comfortable doing that, whether your client is comfortable with that, that comes down to your therapeutic relationship and to your communication. So just check in with your client and ask them whether you're ever too far into their personal space. And you can always work over the drape. In fact, side lying is an excellent position for mobilizing this entire pelvis and working with the lateral pelvis in ways that aren't easily accessible when the client is prone or supine. So using plenty of pressure is just fine for bilateral work, but when moving to unilateral, you may not be able to apply quite as much when using this broad pressure. That will create some rotational force, which can feel a little bit awkward and maybe even unsafe as you approach the shoulder region. So it's just fine down here in the low back, but as you travel up the torso, that can create a little pressure outwards. So just be aware of that. And something that I'd like to point out is that as I press up in this direction, this does press the shoulder upwards into elevation, up toward the neck and up toward the ear. I feel like this is something that a lot of massage therapists aren't aware of, but that can be a little bit uncomfortable, especially for extended periods of time. So definitely shove this fascia upward, shove it superiorly, but make sure to bring it back down. If you notice that you have elevated that shoulder, bring it back down and smooth things back out. This can be an excellent opportunity to mobilize this entire region. Just don't accidentally keep this shoulder elevated the entire time. So one way of working unilaterally while not pushing them off the table is to decrease the surface area that you're using. So instead of using these broad palms to press that can kind of rotate them away from you, use doubled up fingertips to create a finer tool. So you can still apply plenty of pressure, but doing so without changing the shape of the torso quite so much. So while you have all this lateral tissue available to you, this is an excellent opportunity to spread out this QL region, to do a myofascial hold that decompresses this entire lumbar region, that lifts the rib cage. Working with the ribs in this way can allow them to stand up breathing a little bit easier, and sometimes standing a little bit taller. And you have easy access to all of the rotator cuff muscles, with the shoulder in a much more mobile configuration than you'll usually find it. So define the borders of that scapula, and so here's the medial border, here's the lateral border. So everything from the spine of the scapula down is going to be infraspinatus. So you can work with that infraspinatus out toward the shoulder. You can get a different angle on that by coming to the other side of the table and compressing down toward that scapula. This is a great way of working with those more sensitive spots. And you can really define that spine of the scapula. And from this position, this is a great way to compress this lateral border medially. So we're pressing in on this outer edge of the scapula, and that's compressing teres major and minor. You can use the heel of your hand here. You can mobilize the shoulder just a bit as you do this. And you can strip upwards. Just be aware of, once again, elevating the shoulder too much as you do so. Try to pull back in this direction. And of course, you can hook your thumbs under the scapula and access subscapularis. If you'd like to see a whole video on working with subscap, you can click on the bubble in the corner there. And finally, supraspinatus. You can hook in here, lean back just a bit, do some nice pinpoint work, coming out toward this V of bone created by the spine of the scapula and the clavicle. And because we've got this nice thick pillow, the neck is able to stay relatively straight, and it's easy to reach under and to compress both sides of the neck at once. This can be done from this side of the table, or you can come around to the other side and more easily use both hands to petrissage this region, coming up into the base of the skull. And one last thing that I'd like to point out is that you can still use all of your tools here. You can still use your open fists. You can use your fingertips and thumbs as we talked about. There are many excellent applications for forearm and elbow. Just change how deep into your stance you are, and do be aware of rolling the client as you do this. So I would want to trail off with this rather than compress her down toward the table any further. And this last tip applies to any of the limbs, whether you're working with this bottom leg or the top leg or either of the arms. It's to not get too interested in the most accessible parts of that limb. So it can be tempting to just work with this medial portion of the leg and the medial portion of the thigh, because I can just lean my weight on them. And this ends up with me over-concentrating on some areas that don't get a whole lot of contact. So I can overwork this adductor region. I can overwork this medial head of gastrocnemius and kind of impinge on this more sensitive tissue medial to the tibia. So instead of just concentrating on the more sensitive parts of this leg, I'm going to step back, I'm going to stay anchored into the table with one of my knees, and I'm going to brace this leg with my outer hand here, and I'm going to approach the leg like I usually would, by primarily focusing on the posterior aspect instead of accidentally overworking the inner portion. And again, don't forget to use all of your tools here. You can still anchor your elbow into your side and come at this from that 45-degree angle. Alright, so those are my tips and tricks for working with sideline massage. If you've got any tips of your own, please leave them in the comments. Consider subscribing, and I'll see you next time.